want to welcome my friend Ken Thompson, clinical hypnotherapist from thompsonhypnotherapy.net. And today we're going to talk about high blood pressure and natural treatments for it. Chiropractic has natural treatments for it, there's nutrition programs for it, but stress has always been an identified main cause of high blood pressure, chronic stress especially. And hypnotherapy has been a wonderful therapy that is clinically proven to benefit stress. So, how's it all connected? How is high blood pressure? How would a high blood pressure patient see benefit from hypnotherapy?
One of the things about high blood pressure is generally it's when our body's in a fight or flight mode or we're in a high anxiety mode. Anytime our anxiety and stress levels go up, our body goes into the fight or flight mode, the sympathetic nervous system. And basically, what you're doing is getting ready to protect yourself. Now, the problem is that we have evolved that beyond what it was supposed to do. And now we're going into stress mode during normal activities during the day. And that stress load that we're putting on our bodies generates cortisol and adrenaline in the body. And your heart is the focal point of that. So as your heart starts beating faster, all the pressures start going up and the body tenses up and becomes tight. And that stress spreads all through the body. Now, one of the things about stress on the heart that a lot of people don't realize is chronic stress ages your heart faster than smoking does because that
Wait,
fight or flight system is
hang on, Ken. Let me stop you right there. That's a
okay.
big statement. Say it again and say it slowly so everybody understands that statement.
Chronic stress ages your heart faster than smoking does.
Wow. Right? Wow. This is something that many people don't understand. There's been cultures like the Japanese culture that had heavy, heavy, heavy smokers, but they didn't have the blood pressure issues that Americans had. Right? So go ahead, continue from there because I just want to make a big point about that.
Yes, exactly. And that's one of the things about the heart. It is designed to beat faster in stress situations. It's called the fight or flight survival mechanism that we have, the sympathetic nervous system. And basically, it is designed to act fast, to speed up, to dump cortisol and adrenaline into the system so that our body will perform at a higher function when we're running from danger. It was designed originally, it was normally supposed to be just for 5 to 10 minutes or something, just enough to get out of the danger. We have taken that and taken it a lot further than that, and we have made it a something that we use every day to live with. And so it's gone from 5 or 10 minute duration up to 10, 20, 30, a couple hours, a couple days, a couple weeks, even a couple months. And our heart was never designed to be running at that efficiency for that period of time.
I think what you're telling me, Ken, is that the heart and cardiovascular system doesn't know the difference between a lion in front of you about to attack you and you have to run away and your heart has to beat immediately fast and very hard contractions. It doesn't know the difference between that and having a job that you dislike or an angry situation at home or at work that chronically puts your body in a state where it feels like it's running from the lion 24 hours a day. Is that right?
That's absolutely right. One of the things with hypnotherapy is that it's based on understanding how the body can relax itself and how it can release stress and tension from the body through the process of self-relaxation. So what you're basically doing is you're getting the heart to stop beating as fast as it is by allowing it to calm down. The greatest medicine for a high stress situation is calm. One of the things that you can do with calm is bring your body back to reset, back to normal. And that's important when you want to start dropping the cortisol levels, the adrenaline levels, bringing your body's system back down to a normal, everyday activity rather than being fight or flight and in its highly stressed areas.
Well, everybody's thinking now, okay, maybe hypnotherapy can help me with stress, but all they're thinking about is the stage hypnotherapy where somebody's going to act like a chicken against their own will. Describe to us the real situation of how clinical hypnotherapy works, how long a session takes, something like that. Give us an example.
Well, just to understand so that people watching will have an understanding of what hypnosis is really all about. Stage hypnosis is for entertainment, just like professional wrestling is. Actually, your actual hypnosis is your mind's natural ability to relax. It is actually a bridge between your conscious and subconscious mind. Whenever you're daydreaming during the day, you're in a state of hypnosis. Whenever you're in REM sleep at night, that's your mind's natural hypnosis. Anytime you zone out, like driving home and you find out you get there and all of a sudden you realize, I don't remember making all those turns, that is hypnosis. So it's a normal activity that we have. And being able to tap into that, being able to use that to relax the body so that we can bring our systems back down to normal is something that is very easy to do once you learn how to tap into it through hypnotherapy.
Okay. And is it a one-on-one session?
It is a one-on-one session. And with my sessions, I'm not doing group therapy. I'm doing one-on-one. And it's important for me to do that because each person has different triggers and different areas that they're stressing about. And to be able to, one of the things I do with my clients is identify where their stressors are in general. What is it that's bothering them, whether it's a work situation, a family situation, whatever the situation is that's really raising their stress levels. My focus through hypnotherapy is to help them find a way to respond differently to the stress rather than going into fight or flight and elevating the heart rate and blood pressure and all of that.
Fantastic. Great, great, great. So how long does a session typically last?
A session for me is normally an hour long, of which 45 minutes of it is education. I'm a strong believer and advocate of helping my clients understand why their body's responding the way it is. And a lot of times the clients would like to know why their body responds, why they're worried all the time or stressed all the time or feeling these feelings inside they can't describe or can't seem to shut off. I had a client I was talking to just this morning was telling me that her mind never shuts down, it never stops. And all of that can just elevate the stress levels through the body through the roof because the mind is not designed to be racing like that. Again, just as the heart's not designed to be racing like that all the time. And so by being able to turn that down, to be able to bring that to a sense of calm, your body can reset itself. And it's in that calm time that your heart repairs itself. The heart does not hold grudges. If you calm down and relax, it will appreciate it and actually start healing itself.
Very good. I love that. The heart does not hold grudges, but people do.
That's where the problem starts.
Nice. So we identify the triggers, and then you have a 45-minute education session about what those triggers are, how it's affecting your body, get their mindset into a place like, oh, wow, I understand where this is coming from. Then the next 15 minutes is what?
Learning how to tap into that natural ability for us to relax ourselves. Now, a lot of people know about meditation. That's great for relaxing, but it's not really focusing on anything. It's a passive relaxation. It's more of a mindfulness and just being aware. Hypnosis is a state of relaxed focus, and you're focusing on you can focus on the areas that are stressed and actually feel them start to release and relax and calm down. And as that focus continues to spread through the rest of your body, you can feel your whole body starting to relax and rest. And that calm is what's needed and what is necessary for your body to really reset itself totally and get back to a normal standard day rather than an elevated fight or flight mode.
To put it in, from my experience going into your office, you have that 45-minute understanding session where you're learning about where your triggers are, where they're coming from, and how they're affecting your body. And then in that last 15 minutes, there's a very comfortable chair you're laying in. You have almost a guided meditation session. Is that right?
That's 15 minutes of it is learning how to tap into your body's resources and ability to relax yourself. As I said before, not like meditation, which is a general just being aware. Hypnosis is a relaxed state of focus. So you can actually focus on the muscles that are tight. You can feel the tension and you can actually visualize either through sensations or visually for the people that can visualize. You can visually sense those muscles releasing the tension and relaxing and feeling the energy flow back into them. You can feel if your shoulders are tight, you can actually feel your shoulders starting to loosen and to drop. All those muscles around your eyes, you can just get a sense of them releasing and relaxing and going limp and loose. And so you can work your way all the way through the body, relaxing it and releasing it. And all of this is part of a relaxation session that is recorded in my office. And so you'll be able to take this whole process with you. It won't be up to you to remember it. You'll be able to take this with you. And whenever you want to, you can play this back and allow your mind and body to get back to doing that. Now, it's just like going to the gym. The more you go to the gym and work out, the stronger your muscles begin. what you're doing with this mental relaxation is you're exercising your mental muscles. And the more you exercise them with learning how to relax your individual muscles, your neck, your shoulders, your arms, the different parts of your body, your toes, your feet, your hands, relaxing all of those allow you to reach this state of feeling at peace and calm. And that's when your body resets itself.
Fantastic. And, having been a patient myself of yours, having those CDs to retrain yourself every night to relax the area of the body, relax the next area of the body, relax the next area of the body, but specifically guided by your voice, specific to my condition, I felt to be very profound and effective at reducing the stress levels in my life, helping me sleep better, which many of your patients, we've worked on plenty of insomnia patients over the years and plenty of stress patients, but specifically related to heart. There's two parts of the heart that affect that blood pressure. One is how fast it contracts, so you can immediately see the pulse come down, but also how hard it contracts. So the medications that are given to patients either causes it to not be able to contract as hard, contract less, or slow down the heart rate. So those are the two medications that they generally give patients for the heart itself, and they also give water pills in order to get the fluid off the system. So we try to do that all naturally, and hypnotherapy can be a very big component of this situation to get that heart to relax down, just like your muscles will relax down, your contracted stomach that you've had forever relax down, the aches and pains in your back that are spasms can relax down. Just like that, your heart can relax down and get relief, and then start to begin to lower your blood pressure. And as you do continual sessions, the blood pressure will get better and better. And then you can start working with your medical doctor to reduce your medications once it's safely done. And that brings me a question. Is hypnotherapy safe to do with medications?
Absolutely, because all you're doing, it's like it would be, if you could picture it, does breathing affect your medication? Breathing is a natural part of our body, and it doesn't have an effect on the medication. Well, relaxing your mind and your body parts through mental relaxation techniques is not going to affect the medication that you're working with. It's going to affect your body. So it does not have it does not have negative medical effects as far as the medication goes, any more than breathing, changing the way you breathe, has effects on your medication.
So it's a very common question from patients is, can I do hypnotherapy while I'm on my medicine? Absolutely. And the goal is to be able to get your heart to be healthy enough again, get your stress levels down, work with your medical doctor, and have them start to reduce your medication. Because when people get on heart medications, how long is it for? The rest of your life, right? This is a lifetime medication. And typically over time, do they take more or less medication? They take more medication.
The body gets adjusted to it.
It's a lifetime medication, and it adds more and more, and then there's other medications on top of it. So anything we can do to either reduce medication or even actually come off the medication is going to be super beneficial in the long run. And can you tell me about one of your favorite patients or case studies about lowering blood pressure with hypnotherapy?
Absolutely. One of the stories I remember the best and most of all is one of a type 2 diabetic who was actually on two types of blood pressure medications, one in the morning and one in the evening, to get his blood pressure down. And it was something that had been a chronic issue for him for many, many years. And through hypnotherapy, he was able to reduce that stress level in his life to the point where he not only came off the blood sugar medication, but his blood pressure came down to normal, and he no longer needed either one of the blood pressure medications. So he came off both medications through controlling his stress as he continued on. And I can attest to that with 100% authenticity, because I was that person. That was me. That was me then, and this is me now.
I tell patients all the time, I said, I understand where you're coming from because I was a patient before I was a chiropractor. I said, I've experienced, unfortunately, most of what they've come in with. So it's great that you have your own testimonial story and that it moved you enough to go and become a hypnotherapist and to help other people in the same way. Ken, I want to thank you today. You've been fantastic. You got one more
I would like to add one closing note, and that is to just kind of make a statement here that the most powerful cardiac medicine isn't in a pharmacy. It's in your choices. And it starts right now.
Indeed, right? It is up to us and God, of course. So prayer is
Amen.
always, we always tell patients, prayer is primary and then everything else is our job. All right, Ken, very good. So it's thompsonhypnotherapy.net. Make sure it's .net, not .com. And take a look at his website and some of the videos he has on there and such. And Tumminellohealthgroup.com. Follow us on Facebook and Instagram and all those good fun places.
Thank you, Dr. Mike, for all that you do. And my word of the month is calm.
Calm, I like it.
Calm.
Very nice.
Thank
Excellent.
you, Dr.
Take care.